Some local doctors are taking matters into their own hands when it comes to dealing with the opioid epidemic here in Western New York.
Orthopedic surgeons from 8 separate practices developing new guidelines for prescribing narcotics after elective orthopedic procedures. Opioid pain medications are commonly prescribed following bone, joint, and soft tissue injuries, but many times the leftover medication can get into the wrong hands. 7 Eyewitness News reporter Justin Moore on the story tonight.
Our initial thought was we were going to do a research project.
Les Bassan, professor and chair of orthopedic surgery at UB, is joining more than 30 other orthopedic surgeons to do what no other group of doctors is doing.
We can do something that can be impactful and meaningful to our community if we get everybody on the same page.
The group of doctors from 8 different practices in Western New York, including UBMD Orthopedics and Sports Medicine, has come up with new guidelines for prescribing drugs for their patients recovering from a medical procedure.
Patients will take about half of the pills that are prescribed to them after orthopedic surgeries. And then the other problem is that they don't know what to do with the extra.
Doctors fear those opioids are finding their way to addicts and children. Tens of thousands of opioids go unused each year after orthopedic surgeries in Western New York. That's why they're hoping that by reducing the number of opioids they prescribe, they will help curb the overdose crisis.
I think it's really important.
The number of overdose deaths in Erie County is dropping. New numbers show there were 301 opioid-related deaths in 2016. Last year, there were 242, with 18 cases pending.
It's important that we minimize the amount of narcotic pain medication that is circulating in the community.
Erie County Health Commissioner Dr. Gail Burstein says it's great news that doctors are getting in front of this epidemic, but she would like to see more non-opioid drugs like ibuprofen used for pain.
We've seen that over the past year and a half that hydrocodone, a narcotic pain medication, has dropped from the #1 prescribed medication at all in all of Medicaid in Erie County to #5.
Now, Bassan says by reducing the amount of opioids they prescribe, there will be 150,000 less opioids on the streets of Western New York. Now, if every doctor in Western New York gets on board with that, that means over 1 million opioids will be off the streets. Now, doctors say they are also looking at alternatives to use instead of giving patients painkillers. In the newsroom tonight, Justin Moore, 7 Eyewitness News.
Thank you, Justin.